Good morning, everybody. I'm Jaime Simoes, and I'm here on behalf of Protect Our Care New Hampshire to take a look at where we are and where we're going in terms of healthcare for granted staters. There have been some very dramatic changes in Washington and a few in Concord. And I think we're sitting here left with the harsh implications of some of the deepest cuts to healthcare in American history. We have seen over the last few weeks slashes to Medicaid and the Affordable Care Act, potentially taking healthcare away, access away from 17 million people across the country, including tens of thousands here in New Hampshire. A lot of that supposedly to fund tax breaks. So, we know that these cuts will increase costs. And we saw last week in Franconia that they could impact healthcare facilities, forcing closures, not just of clinics, but hospitals, nursing homes, and potentially force thousands of New Hampshire residents into medical debt. So it is with the hope of unwrapping this and explaining it. I have two really good guests here with me today. Christin H, who is the founder and principal of Putney Consulting, and Sam Burgess, who is the healthcare policy coordinator with New Futures. You've both have been on this program before. I really appreciate it. But since last we talked, a lot has happened. Sam, do you want to just give us a quick overview of what you're seeing now and where do you think we are?
Yeah, thanks, John. I appreciate it. So a lot of the things we talked about before that we predicted did end up showing up in the reconciliation bill, HR 1. That includes work requirements, increased eligibility redeterminations. The bill restricts states' abilities to finance Medicaid through provider taxes, and it includes premiums and cost sharing for those who can afford it least. I think taken together, when we look, after the fact at HR 1, these provisions accomplish two things. They throw up a number of administrative hurdles, making it harder for granite staters who qualify to receive the health care that they need. And second, it reduces New Hampshire's overall Medicaid budget. Um, I think putting it into context, what does this mean? That means that ultimately, for those who are able to jump over all of the new hurdles that have been thrown up by Congress, those New Hampshire individuals and families are going to have to make the impossible choice between paying rent, putting food on their table, and paying for their health care.
That's not an easy choice, man. And I think we can add to that filling just basic prescriptions.
Right, certainly.
Kristen, good to see you. So from your perspective, how are these cuts going to specifically impact New Hampshire's Medicaid recipients, especially seniors and children?
Well, I think maybe some people don't realize that Medicaid covers seniors where Medicare does not. One of those areas is certainly keeping people that are older in their home when they need to receive care versus ending up in another facility where they're getting assisted care there. We see that there's an increase in quality of life for individuals who can stay in their home, and it's a reduced overall cost to Medicaid. So it's kind of a better situation and win-win. But if we're not allowing Medicaid to reimburse, members, people who are caring for their family members in their home, all of a sudden it cuts out that loop of actual cost savings and increased quality of life for older individuals in New Hampshire. And those aren't the only individuals impacted. We know that Medicaid really covers a lot of women and children in New Hampshire. So any increase to decrease in access, increase to cost, those will affect the people that can access or pay for those services. It doesn't seem like a lot sometimes when we're talking about a small amount that might be now an increase in your prescription copayment. But if you have a child who's receiving behavioral health or mental health supports, they might be on a number of medications. So, multiply that times 3 times per month, and it does add up over a period of time, especially if you're just meeting the requirements of your income. If you're making $37,000 a year, that's not a lot of money And that's more than the federal and New Hampshire minimum wage would pay you, though. So you could be working full time and still not be able to make those payments. It just, things really do add up.
They do. Thank you. Sam, let me ask you, speaking of things adding up, what is the impact on our rural hospitals? And, again, we got some bad news out of one clinic in Franconia. We've seen a wave of acquisitions and mergers where nonprofit hospitals have been acquired by for-profit out-of-state healthcare organizations. So we're looking at loss of funding now. In other words, that the patients that they rely on, that they serve, won't have the Medicaid funding or the tax credit support for their ACA coverage. What's the prognosis look like? What's the picture that you're seeing?
I think you put your finger on it, John. I think that our rural health providers, and especially our critical health care hospitals in rural communities, rely heavily on Medicaid funding. And with the increased disenrollment we're getting out of HR1, these already cash-strapped hospitals are going to face a further crisis, and that's only compounded by, as you mentioned, hospital consolidation increases we've seen over the past few decades. I do want to take this opportunity to put my finger on one thing we've heard a lot out of the media, which is the Rural Health Fund, which Congress set up as a part of HR1, which some in Congress have championed as a catch-all to save rural health care. I think there are some major downsides to the healthcare fund that have not been discussed. I have a few things to note. First, the $50 billion in this fund is only about 1/3 of the estimated loss of federal Medicaid funding in rural areas. The total losses that are born out of HR1 are going to be about 155 billion over 10 years. So this is 50 billion out of that 155 billion chunk over a 10-year period. Second, the Rural Health Fund is only a temporary fix. It's about $10 billion between fiscal years 2026 and 2030, whereas the healthcare cuts that we've seen out of HR1 are not time limited. Lastly, it's not clear how these funds are going to be distributed to states, nor is it clear whether CMS or states are going to be transparent about how these funds are going to be distributed. So with all of that in mind, the Rural Fund, as Congress has currently passed it, is at best a temporary Band-Aid for rural healthcare.
All right, well, that's not good news. And related, but not directly to the money, Chris, and I want to ask you, we've been talking a lot about maternity care deserts forming in rural parts of the state. Obviously, this impacts clinics and hospitals, and there's not enough money to help them survive the loss of people on Medicaid and Affordable Care Act exchange plans. What does that do to this growing issue of maternity deserts in New Hampshire?
I mean, preventative and perinatal care are highly important. When we reduce access to care, you have to travel longer or you don't get that preventative or perinatal care. And the outcomes end up being poor, usually, right? And so people either delay care and their illness or chronic condition just gets worse before they end up in an emergency room, or they don't get perinatal care and they have poor birth outcomes. And those are New Hampshire lives of New Hampshire children. And, we have the data to show that when you get perinatal care, you have better birth outcomes and better expectancy for those children that are born, where they're in their mental health and their physical health. And that plays out for the economic growth of the people growing up right here in New Hampshire. Like that's, who do we want to have living in our state? People that are born in New Hampshire and then get to grow up here, right? How great is that? But if we cut off the access to that care, we're talking about death. We're talking about poor health outcomes. And it's not just in rural areas too. I mean, we're going to see the providers, the healthcare providers that service areas where they get paid less and they have to see more patients are rural and in cities in like Manchester, right? And they're seeing people that are covered through Medicaid, and everyone is playing their part because they care about other people. They're not in it for the money. We're cutting off their jobs. We're going to force closure, and that's economy in those areas where now there's there's no jobs for anybody. And it's not just the healthcare providers, it's everyone that works in that hospital system too. And then we have a transportation issue. So now we're forcing people to go further for care. So it's just so interwoven like a big web, and it's affecting everybody.
Well, the one thing we haven't hit on then is the cost of healthcare after all these changes. I don't know if either of you saw that KFF, the Kaiser Family Foundation, had a study out this week predicting that premiums may go up as much as 75%. And that's an almost unbelievable number. We've been looking at 9% a year. 75% means a lot of people are going to perhaps fall out of the roles of the insured or be downgraded because they're going to have to cut back their coverage. Sam, what does this mean for out-of-pocket costs and premiums for granted staters, as well as businesses, who get their coverage through the marketplace?
Right. Thank you, Jaime. Yeah. So we've heard a lot over the past few weeks and months, rightly so, about the cuts to Medicaid through the bill that are explicit. I think the large elephant in the room that has not been discussed as much, which is ultimately going to be the first foot to drop when all of these changes start going through, is Congress's decision not to extend the enhanced premium tax credits for the ACA marketplace plans. In New Hampshire, the vast majority of those on the ACA marketplace receive these enhanced premium tax credits. So all of those people, when they go back to open enrollment for this upcoming year, are going to see, as you mentioned, their premiums skyrocket. As you said, KFF has mentioned that for these people on the ACA marketplace, they're going to see as much as a 75% increase on the premiums next year. To put it into context a little more, if someone paid $60 a month this year, they're looking at $105 a month next year. These expiring tax credits, if you look at it nationally, they could result in a 1/3 cut to enrollment on the marketplace. Proportionally, that's a much bigger impact than the direct Medicaid cuts we've seen through HR1. I think we need to be sounding the alarm bells about these expiring tax credits and the outsized impacts they're going to have on the newly uninsured granite staters that rely on them. And then I guess the knock-on effect of uncompensated care as well.
Well, Kristen, I'd like to ask you about communities of color and new Americans in New Hampshire. I know you've done lots of research work throughout your career about the impacts of funding and healthcare coverage, but I don't think we talk enough about communities of color and new Americans in New Hampshire, and how are they going to see the impact of these changes and budget cuts?
Well, we saw that when we raised hurdles for people to access care before, when we did the work requirement, let's say, we already saw in New Hampshire that played out where people didn't renew, and we saw it play out in communities of color specifically, that there was lower enrollment at that time. So that we have the experience in our own state already from doing that. If people are disproportionately not receiving care now, then when we raise hurdles, raise costs, raise barriers, they will access it less. The proportion becomes greater, right? It's just math.
And it's not good math.
No.
Thank you. Well, finally, I'd ask, either of you to answer this question is like, so what are healthcare providers and advocate organizations doing now to prepare for these changes? And what support do they need right now here in New Hampshire? Because obviously, none of the scenarios for the future look to be anywhere encouraging or good.
I mean, I can say for some advocates that are working in related areas, like if you look at people who are helping with food insecurity, for example, right? The burden falls on communities and individuals and advocacy organizations and nonprofits, right, to step in when our structure changes or falls. And that's what's happening. So what can we do? We can, talk to people making laws and tell them about, our personal experiences. How has that affected you personally? Because that is the real example.
Yeah, and I'll build on that as well. I think storytelling is a huge part of this, as Christian mentioned. I think on the state level in New Hampshire, we live in a very interesting state where you're more than likely to have a neighbor who's a state representative here. I think, yeah, as we've talked about, these changes are not only happening at the federal level where things feel very insulated, where things are happening here in New Hampshire as well. We're seeing premiums, we're seeing cost sharing, we're seeing pushes for work requirements. Reach out to your neighbors, your representatives. We can start the change here on the state level as well. I think federally as well, even though Congress has failed to extend the ACA tax credit so far, there's no reason why they still can't. There's also already been conversations among Senate Republicans to add more money to the rural fund. So I'd encourage any Granite Stater to reach out to a representative, ask them what their position is on tax credits and on the rural fund. And lastly, I'd make the plug, go to New Futures or other advocacy organizations, sign up for mailing lists so that we can keep you up to date on advocacy opportunities.
Well, Sam and Kristen, thank you for helping to explain, I don't want to say the unthinkable, but perhaps the unimaginable, and also give us a little bit of hope that there still is time. We shouldn't give up on ourselves or our neighbors or our communities, that we can still reach out and try and make a difference and hold people's feet to the fire to do better. I want to invite my colleague Rachel Hines on because she has been seeing if we have any messages from our friends in the media who joined us for this discussion. Rachel, good to see you.
Thank you. And thank you everybody for joining us today. I'm sorry if my background is still loading a little bit. But we would now just like to invite the press to answer any questions that they have for us. And if you have a question for a particular speaker, you can just drop that in the Q&A box below and yeah, and we will go from there.
I think Amanda has a question, so because her hand's up. So Amanda, if you want to type it into the Q&A box, I know Rachel has a question already queued up, but then we can ask that one next.
Yes, thank you. If you would put it in the Q&A box, that would be great. Okay, and as John just said, our first question was submitted ahead of time, and this question is for Sam, and that is, as the impacts of this bill are far-reaching and, like Jaime just said, unimaginable, what does New Future see as the best road ahead?
That's a good question, Rachel. I think at this stage, I think going back to the previous answer of advocacy, finding opportunities to talk to make change here on the state level. I think another big piece that we haven't really discussed is the fact that the way HR1 was designed with some of these healthcare cuts was in a staggered fashion. So we're not going to see the effects of some of these provisions like work requirements, like some of these premiums and cost sharing provisions for years to come. So I think keeping the message out, ensuring that those who are affected have advance notice, ensuring I know that some of our state agencies take on that role as the megaphone for some of these changes to the people affected. So I think keeping the message alive, making people aware while also pushing for change is going to be our approach at New Futures moving forward.
Thank you, Sam. I will now turn to our next question from Amanda Goki at the Boston Globe. Amanda is asking if we could discuss the impact of changes to the provider tax.
A really good question.
So, Christy, do you want to go ahead? Go ahead.
You might have more details than I do, Sam. I just was going to say that, if we can't, that one thing to understand about the provider tax is it's cyclical, that the tax in the end ends up funding where the providers work as well. It's like it feeds itself. And so removing that and not allowing the state to be able to implement that just reduces funds overall and reduces how much funding the state can get from the federal government for the program. And Sam, you have more details, I know.
So I don't have minute details. I guess the best way I could describe it, and this is probably not new news to anyone here, But essentially, what provider taxes have been is a way for states to increase their proportional share of Medicaid funding before it's reimbursed and the federal government pays their proportionate share, right? There's been a lot of messaging at the federal level that this is a workaround for states to get more money from the federal government. I think the big takeaway of provider taxes, though, is whatever you want to call it, what these cuts are going to do is reduce the overall state budget for Medicaid. So that's less people on health insurance, more people relying on uncompensated care. It's all in all just going to result in a net loss for the state of New Hampshire.
Thank you, Sam and Christian. Now, if no one else has any questions for our speakers today, we can wrap things up there. And Jaime, I will turn it back to you. And thank you again, everybody, for joining us today.
Sam, Kristen, and of course the people from the press who've joined us, thank you. It's hard to believe that next week, next Wednesday, Medicaid will turn 60 in America, and we're going to try and do a podcast on that. It's been a transformative program. It has offered health coverage and a safety net to working families across our country and in our state. To see it put at such dire risk to fund tax cuts is a very difficult concept as an American to get one's head around, but here we are. So I want to thank my guests for having unpacked this and helped us understand the impacts. And it sounds like they're not good, and people are going to get hurt, and it's not going to make New Hampshire a safer, better place. So all I can say is, speak up and speak out. This is not political. This is about the wellness of our friends, our neighbors, and our families. And hopefully, as a group, we can do something about this. So until next time, Kristen, Sam, and Rachel, thank you. It's good to have these discussions, and I look forward to keep having them. On behalf of
Thank
Protect Our
you.
Care New Hampshire.
Thank you. Thanks so much.
Thank you.